So welcome everybody to the COVID Community Champions. I hope you're all enjoying half term. Those of you who've got kids at home or looking after grandchildren, it's usually the best time of year for me, half term. So as usual, this meeting is being recorded. If you don't want to be recorded, please keep your video off or keep yourself on mute. You can ask questions at any time. Emma and Emma, if you see people in the waiting room and I've missed them, please would you mind letting them in for me? Thank you ever so much. So here's the agenda, short one this week. We've got a COVID update from Emma, vaccine update from Sarah. Winter wellness is going to be a theme that Emma's going to tell you about, and then I've got a few little links and things about long COVID and a bit of an ask for you all. So without further ado, here's the intelligence update from Emma.
Thanks, Tracy. So as usual, we've all the sort of caveats around the data and what it now tells us. So we're looking at the case data, the positivity rate and the testing information here. So we can see that our positivity is higher than it once was. So it's probably well above that 10% there in that green line for Wakefield compared to the England and West Yorkshire levels. That is often driven by that we're just doing better at testing those people that would typically be positive. So it's nothing necessarily to be overly worried about in terms of the positivity at this present time, because you can see that actually overall the number of tests that are being undertaken is still on that downward trend, as per England and West Yorkshire as well. And sort of our case rate data, we had our peak sort of winter COVID in the last few weeks, and we're on a downward trend now in terms of COVID cases. Thanks, Tracy. Next slide. This shows the cases in terms of pillar 1, which is the hospital-based data, and then the pillar 2, which more community-based data. So that again shows that downward trend after the winter sort of Christmas period, where we did see that spike in COVID cases. And actually we saw that spike around flu as well, seasonal flu cases. Next slide, please. And this shows the ONS information for the region, and we can see of all the regions, Yorkshire and the Humber are sort of top of the list in terms of our infection rates at 2%, and the next being the southeast at 1.7%, and the lowest being the northwest at 1.4%. And there's some stability within the infection rates from a Yorkshire and Humber perspective, and sort of a slight uptick in the southeast. And we've always known that there'll be this variation of infections across the UK over the course of time. Next slide, please. And this shows us the age information, again taken from the ONS data, and showing that our largest percentage infection rates are in the 7 to 11-year-old age group at 2.2, whilst our lowest is in our over 70s at 1.5. And sort of slight uptick across all the age groups, but this data dates back to the 31st of January, so it is sort of that period where we were seeing infections around the second week in January, that Christmas winter period again. So nothing to be overly worried about presently. Next slide, please. Again, this just shows you the age-related data. Next slide,
I was looking
please.
a better colour, Emma, than it was.
Yeah, it will always flux, won't it?
Yeah.
Again, it's nothing unusual that we aren't familiar with seeing at the moment, but I suppose it does show that actually largely the infections are in those older age groups, which is why we do have the vaccination programme. They're the groups most at risk and benefit the most from the vaccination programme compared to the younger age groups. Next slide, please. Again, this is just the hospital inpatient data that everyone will be familiar with for seeing that downward trend that we're seeing presently. Next slide, please. And this is the COVID-19 related deaths picture that we are familiar with seeing as well. Next slide, please.
Oh, sorry.
Yes,
I
sorry.
think that was
Probably
you.
maybe not as informative, but I think it just shows that not a lot changes in a period of time, and we just continue to monitor the surveillance data as we have been doing.
That's brilliant. Thank you ever so much, Emma. Does anyone have any questions for Emma? Let's see if there's anything in the chat. Excuse me a minute. Keep getting things popping up. Oh. I don't know if any of my colleagues can see anything in the, oh no, there's nothing in the chat that I can see. No questions that I can see. So thank you very much, Emma. As usual, if you do have any questions, please ask us. I know there's quite a few acronyms in those slides, but hopefully we're all aware of them now. ONS, Office for National Statistics, etc. But if there is anything, please do ask. So thanks ever so much, Emma. So now we're over to Sarah, who's going to tell us about the Wakefield winter vaccinations.
Hi, everybody. Can we have the next slide, please, Tracy? So I manage the COVID vaccination programme, and I also work closely with colleagues who manage the flu vaccination programme for Wakefield. So as you can see from the previous slide, the title was about arrangements between booster phases, and we've actually this week, for the first time since the 21st of September 2021, not been offering boosters. So it's kind of a nice position to be in, really. We're moving going forward to having 2 booster campaigns a year, we believe, a spring booster campaign for a limited number of people, and then autumn boosters that fall around the timing of flu boosters for many people. So we gave our last boosters for the autumn the autumn and winter campaign that's just closed on Sunday. As you can see in Wakefield, from a significant population, we gave nearly 120,000 doses, nearly 120,000 autumn boosters by the end of the campaign. So that's now complete. Our uptake overall of everybody in Wakefield who was eligible for a booster was 63.5% of them came forward. And while that is never going to be high enough for me in my job, it is reassuring that if you take the average uptake for everyone over the age of 65 or in care homes, 87% of those most vulnerable people took up their offer of vaccination with a booster this season. And if you think back to the coloured heat map that Emma shared with who is most likely to be diagnosed, have a confirmed infection with COVID, partly because they're probably quite poorly with it, that is that older age group, and we have really, really good coverage in Wakefield, although I'm never going to be happy unless it says 100%, but 80%, 87% exceeds the national target, and we've done better than neighbouring areas, which is all good. So at this point, if you have not had, or you have a friend who has not had their autumn booster, then the boat has sailed, they cannot now access it. What we are still offering is primary doses. So anybody who hasn't had their first or second dose, they can come forward and ask for that, and they will receive it. People are still eligible so long as they turned 5 by the 31st of August last year. JCVI said there was a one-time offer for the younger age, the 5 to 11s, and they're not continuing to roll it out. It's highly likely at some point, if it's needed, they'll maybe do a couple of year groups in a school, but we don't know that that's coming just yet. That's something for maybe 2 or 3 years in the future, depending on what COVID's doing. So for the vast majority of people have already had their first and second doses. If anybody hasn't, though, it's really easy to get one. You book via the national booking system online, or you can contact your GP. Your GP may actually try and book you online or ask someone to support you to do that. That evergreen offer, so far as we're aware, continues, and it's because the JCVI are looking at studies, and they're showing that absolutely the best immunity among the population is where people have had a vaccination and maybe also been exposed to the virus, because you get a reinforced immunity through that exposure. So you might have a mild case after vaccination of COVID, It certainly is preventing the vast majority of people from being really seriously ill and going into hospital, and therefore it's done is it's promoted their immunity so that they are much better protected. They call it hybrid immunity, and going forward, I think that is the way to look at this. People have had their primary vaccinations. They're either going to get a booster, or from time to time they'll be exposed to the virus because it's still circulating in some form, and therefore that kind of tops up their immunity. A very small number of people who are immunosuppressed, if they haven't yet had a third dose, they can also access that, but that's not a booster. That's just because it's harder for those people to build up that immunity. So there's a decision for them that they can have that third dose to just make sure that the immunity sticks. Okay, so no more boosters at this point, and primary doses are still available for people if they want them. Just in relation to, if you do know anybody who wants one at the moment, who needs that first or second dose, or maybe a third if maybe they're having cancer treatment or something. As of this week, we only have one service running in Wakefield. People are taking a well-deserved rest because it's half term. So we do have Excel in Normanton operating this week. But from next week, we should have also Boots in the centre of Wakefield and Medichem in the centre of Pontefract. And Boots and Medichem will also do children under the age of 15 if they are still waiting for a dose. So we do have reasonable coverage in Wakefield, but the volumes are very, very low. I have to say, you know, we're talking about 2 or 3 dozen people a week is our current expectation. Other than where people want to get their immunity established through those first vaccinations for health reasons, there are still a few countries, and I think most notably America, who will not accept anything other than vaccination, proof of vaccination on entry to the country. So we are finding that a fair number of people coming forward actually just want to travel abroad now. And it's great that people can travel again. Okay, so having said that we're not now giving autumn boosters, that programme is closed and that we're moving to a twice a year booster programme, we're about to hear about our spring boosters. Apparently the Joint Council for Vaccination and Immunity met yesterday. So very shortly, I'm expecting a cascade of information out to us in the programme, and then maybe it'll get mentioned in the press, although it's not a headline in the same way as it was maybe a year ago even. We've been told to plan for a spring booster that will start during April and run into May. And again, similar to last year, that spring booster is for a much reduced part of our population. It's for people in care homes, people over 75, and people who are immunosuppressed. And they're all the people who are most likely to find it difficult to maintain a good level of immunity because maybe their own immune systems are no longer quite as strong. Just a kind of a note of caution, obviously people are getting used to getting regular boosters or vaccinations. We're now moving to a twice a year booster. It's not continually offered, and we're likely each time to try and get these done and dusted and out of the way and everything boosted in a shorter period of time. So it may be that if people haven't come by the end of May, it's very difficult for them to get their booster. So if you do know people and maybe as we're getting into the spring they haven't got around to it, it's really worth encouraging them to come forward. We don't have very much detail about the autumn boosters just yet, other than knowing that it's highly likely.
All right, I've just left timesheets of additional hours for Ray, Leslie and Kerry. Well, this.
Okay. So I've covered everything that I wanted to cover.
Well, sorry about that. This is everything that Sue said she now needs.
No, I'm trying to find it. Wait a minute, here we are. See if I can mute her. Look like I've muted her. Some people come
I'm sorry, I was just conscious that people probably couldn't hear what I was saying. Yeah, so that's it really. We'll obviously update people about autumn boosters as we get closer to the time, but for the time being, it's just strongly encourage anybody who hasn't had the primary doses yet to come forward. And when we hear about the spring booster and we've shared a bit more information, if you know people who can be encouraged to take it up, try and get them to come a bit more promptly. We're very conscious that because we started vaccinating in September to April is a long time not to have a booster if you're elderly. So we'd really like to get those doses into people promptly. Thank you, everyone.
Thank you ever so much, Sarah, and thank you to you and your team for all that sterling work. That number of boosters is quite remarkable. So, and it was extra to the day job, wasn't it? You know, we weren't expecting this, and they've worked extremely hard. Yeah.
Well, we're quite closely watching the data at the moment, because fairly soon, probably during the spring campaign, we will pass a million doses of vaccine in Wakefield, which is just incredible, isn't it?
It's amazing. So thank you ever so much. Yeah. Where would we have been without that team of people?
Exactly.
Yeah, that's awesome. Thank you ever so much. Does anybody have any questions or comments, please, for Sarah? Can't see anybody's hands up, and I can't see anything in the comments. As usual, you can email me anything, any words of thanks to Sarah and her team. I'm sure will be very, very welcome. Thank you. So now we've got Emma, who's going to tell us, Emma's from our communications team, and she's going to tell us about our winter wellness campaign. Over to you, Emma.
Thank you. Just wanted to remind everyone about the web links that we've got. So if you're looking for general health advice during winter, including tips on how to keep warm in your home and how to look after your mental well-being, you can go to our winter wellness page. If you're looking for health advice for children and young people, visit the Healthier Together website. The information on that site that's been reviewed by local paediatricians, GPs, community pharmacists, and 0 to 19 year services. So it's like a really valuable resource. We've also got our winter wellness booklet and translated versions, and also an easy read version at those links there as well. Can you go on to the next slide, please? Thank you. So for our winter wellness campaign this month, I just wanted to show you the assets. We've gone for a Valentine's theme. It's coming towards the end of the campaign now, so we're just recapping the messages that we've been promoting throughout winter, including protecting yourself from winter bugs and looking after your mental health. We've also created a really great video where we went to 3 local schools and we asked children how they keep well over winter. So if you keep an eye out on our Facebook page, you'll spot that as well. Thank you, Tracy.
Thank you. And that little clip, the winter wellness clip that Emma's talking about with school children, is absolutely fabulous. It's only a few minutes, but if you want a little giggle over your coffee break, I can heartily recommend that. It's a really good video. And just a few things from me, as it is Healthy Heart Month in February. Quite by chance, a colleague actually circulated an email recently, and it was a defibrillator. I hope I've said that right. Defibrillator finder. And it's a website where you can go and find the nearest device to you. And I think that's really useful for you to have a look at, see if there's one near you. If there isn't one near you, maybe think about letting us know, and we can see if there's any funding for any community groups to possibly apply for a defibrillator. That are known to save lives. So that's a really useful web page. And as it's Healthy Heart Month, we know that walking and cycling is really good for your health and well-being, and the weather's getting better now. So there's a couple of links there to the walking page and the cycle map. I've had a look at this morning. That's really good, actually. Some colleagues in our health improvement team have also made a community cookbook, which is great. I've downloaded that today, and I'm going to have a go at some recipes, so I can heartily recommend that. And as you know, smoking's not great for your heart, so I thought I'd just put another link there to the Quit Smoking web page. So all of those are really useful links that you might like to use and share. And then just a reminder, I did send an email out. It was ages ago, so it probably got lost in all the plethora of things that I sent. So if you didn't see it, it's just a reminder that our team were offering people a free place for a wellbeing day at Northern College. The Wellbeing Day at Northern College, they do these anyway. So if you look on their website, Northern College is in Barnsley, but it's South West Yorkshire. So West Yorkshire do our West Yorkshire Mayoral Fund, or somebody contributes financially, so it is within our district. They do wellbeing days throughout the year, and I've been on one myself. It was fabulous, and some of the members of the Positive Mental Health Network went and had a bespoke day for us. It was really super. and we have 5 free places left. There's a lunch involved. It's an absolutely beautiful place. The grounds are spectacular. So if any of you are interested, please do let me know. The purpose of it really is to look at your own well-being and to help to fill your own cups, because we do know that people have worked really hard through COVID, supporting others, sharing information, and actually if you feel a bit depleted with your mental health and resilience, it's a good time to take a day out and replenish that, look at your own resilience. And we also have free places left. I think there's 5 for our easy reading training, and that's exceptional. It's with Easy Read, based in Wakefield, and it's a half a day. You take a document with you that you might want translating into Easy Read, and then Louise from Easy Read looks at that and gives you feedback, and then there's another 2-hour session to finish off that document. And Emma has just been speaking to you now, and myself and some colleagues have done it, and it's not particularly easy, but it's a great training to look at communications, how you communicate, how to make things easier to read and understand, not just for people with learning disabilities, but for everyone really. So if any of you are interested in either of those or want more information, please do get in touch. You can contact us anytime at ccc@wakefield.gov.uk or tleach@wakefield.gov.uk. I've got one more call now asking for your help really, and this is from my colleague Lisa Chandler, and she's working on respiratory and she's working on long COVID. And this is a slide that she's prepared for me today to say about chest infections, coughs, wheezing and breathlessness are all signs that are often ignored or put down to the time of year, getting older, smoking, being unfit, etc. But sometimes these things do actually need checking out by a doctor. Most chest problems are easily treated, but we need people to come forward earlier. We're finding that people are coming late in the day and they've had symptoms for a long time. So to get the best outcome possible, people need to come earlier with the symptoms and get them checked out. So Lisa was asking me if we could have a special session with you, our COVID champions, and Dr. Hickman, who is a GP who specialises in this area, to help raise awareness of lung health out in the community. So they're wanting ideas from you about where we can go, how we can engage with people, because people are not coming forward, so we need to find the people who are most vulnerable, and maybe do some myth busting with them, as well as encouraging people to get checked out if they've got symptoms of long COVID, chest infections or breathlessness. So she's asked if you can please let me know if you would be interested in having a quick Zoom call with Dr. Hickman to talk about these issues about lungs, how to look after your lungs, and how to engage with people wider in the community to share messages to try and improve the outcomes for people, to get them to come and seek help earlier. So please do get in touch if that's something that you think you would be interested in, and we'll set up a meeting to discuss that. Or if you've got any tips or ideas how we can come out into local communities and give that advice and information, please do let me know. Oh, and I think that's it for us. That's it for all of our slides. Thank you very much. Does anybody have any questions or comments, please?
Tracy, do you think they'd do the lung session as a recovery college session?
Oh, I think that would be a fantastic idea, Lindsay. And it's something that we can definitely ask about, yeah.
Marvellous. Would you mind asking her for me? And then if
I
it's
certainly
then
will.
We'll try and set something up.
I certainly will. I shall do it straight after this meeting. That's a brilliant idea. Thank you very much.
Can I ask something?
Hello. Yes, of course
Yes.
you may.
I've had a PE about 4 years ago, and I put it down to being older and, you know, when I couldn't get my breath. It boils down to the same old thing, the same old chestnut. It's getting a doctor's appointment to get in.
Right, yes.
This is what it all boils down to. It's very easy for us to tell people to go and get help. But the urgent centre here at Pontefract is full of people that can't get doctor's appointments. And I can guarantee that I've seen it for myself. I've been in there. I was told by the GP.
I'm only
there.
smiling, not because of what you've said, because what you've said is definitely not a smiling matter. But yesterday I was in a meeting with one of our officers, Claire Offer, who she's given us updates here quite regularly on our COVID champions. And she held an initial meeting for cardiovascular disease to see, to ask what we can do and can we work together co-productively with colleagues in NHS, etc. And we were talking about signposting, and I said, you can signpost as much as you like and get people as much as you like, but if you can't get a GP appointment, then that's the massive issue that I've personally heard. So they said, well, is that isolated? Has it come from other people? So I can say now with my hand on my heart, seeing as it's Heart Month, that it's not just me. People do have problems getting an appointment. But what they also said was there were several different ways, and you don't always need a GP appointment. There are other routes that you can take to get help and support, not necessarily a GP. So there are lots of things to explore there. But thank you so much for that feedback, because it just verifies what I was saying about when people need to be able to get an appointment.
Well, going on from that as well, I asked for an AMP appointment. Apparently the AMPs only release them on block, and sometimes they can be a fortnight away. I got one a fortnight away in December after my husband came out of hospital with sepsis. I had no care plan, nothing, and it took me a fortnight of waiting. I said, I don't need a GP, I just need an AMP. I couldn't go to the pharmacist with that, but the pharmacies are overwhelmed. It's all very well us telling people where to go, but everywhere is overwhelmed. And the infrastructure to go to the pharmacies was never put in place. All you get is people going in and say, can I have a word with the pharmacist? And even the pharmacists sometimes are doubtful and that don't want to have it left to them to make the decision. So, it goes round in circles. When I'm here and I get all sort of zoomed up, if that's the right word, with all that's said. But when you boil it down, it's still going down to the brass tacks of a GP, AMP. We only release them in blocks, and they're taken straight away because they said, "Oh, ring at 8 o'clock." I said, "Me and 30,000 others." When it's I find it difficult to say when it's urgent in an emergency. It is to me.
Yes, but of course.
Is it in the great scheme of things? Do you know what I mean?
I know exactly what you mean. Yeah.
So I think a lot of people have a lot of problems. I put mine off for over a week going to the doctors until I passed out, and they had to take me to the hospital. So,
oh my goodness.
Yeah, I wouldn't recommend it. I won't ever do it again. I was even taking my husband's angina spray because I couldn't get the breath. I still thought it would be, you're overweight, you're older, and all that. I've gone through the scenario in my head, and I'm supposed to be telling people, but you do put it off. It was only a year later when I realised just how poorly I'd been.
Wow.
Yeah, it's a spontaneous PE because I've never smoked. Unless I was a passive smoker, I don't know. But anyway, let's go off on a tangent. It's just where to refer. It's all very well us saying go to your pharmacist, go to get an AMP or an ACP as we've got now as well. It's just, you just meet brick walls all the time. And I've experienced this personally in the last 6 weeks. So I know it's not just people saying it because it's the fashion to say it.
Thank you very much. I'm just looking at, when you come onto Zoom, it just says your name as Health. So I've just popped my email address and my telephone number in the chat. If you would like to chat to me further about it, I've made some notes about it, and I will definitely feed that back. And I will feed it back to Claire Offer, who's leading on the CVD meeting that we held an initial meeting for, because this is really vital that it's not just me saying it, and we can evidence that this is happening to other people. John Nice put something in the comments that they've brought GP surgeries to the peer leaders meeting, so peer leaders are also looking at this issue, I think, John, if that's what you're saying. So that's really good evidence for me to go back and say this is what the community is saying. So thank you very much for that information. Happy to chat with you outside of the meeting. I've given you my details. But things like this are vital, and that's why the COVID community champions are so important, because you know what's happening in reality. It's all right us giving a scheme or saying do this and do that, but if it's not working on the ground, we definitely need to know so we can do something about that. So thank you very much for sharing that personal story. And I'm sorry if my smiling at you was totally inappropriate, but it was just reiterating what I only just said yesterday. I felt a bit of a lone voice, to be honest with you. So when you said it, I thought, oh, it's not just me. It's definitely the reality.
To get my experience, because I was there with two heads. I was there as a support to my husband, but I was also there looking through the eyes of COVID, Health Watch, and the managerial side. Well, I won't go into it now, but I will talk to you about it. I mean, our nurses and doctors are doing fantastic under the circumstances.
Absolutely. It's not the individuals, is it? It's the system. And I'm sure we're all clear about that, because everybody who was on the call today, who was working on CVD, the doctors and the nurses that I've spoke to are all, you know, trying to do their best in difficult circumstances. So it's looking at the systems and where we can improve on those rather than individuals who are doing their utmost.
If we don't do it, if we don't get something in place very soon, we're going to regret it. And they're working themselves into the ground. I've experienced it 24 hours. You know, there's no night and day in hospitals, as we know. But I will be in touch, Tracy. Thank you for that.
On the contrary, thank you. Does anybody else have any comments or questions? I can't see any hands up. Let's have a look. Oh, Anne-Marie. Also, you can feedback any experience of local health services to us at Health Watch. It's important that we hear and record these to feed into the system. Absolutely. And I'm sorry, I didn't think to say that. Absolutely. Health Watch are the place to go with these kind of scenarios. So if any of you are sat there thinking, well, I know similar stories or something similar's happened to me, please do share that. Any information is really useful to us. So thank you for that, Anne-Marie. Is there anything else from anyone? I can't see anything else. So all that remains for me to say is, again, thank you everybody on the call. Thank you very much to all the COVID champions, those who can't make the meetings, but listen to the recording after or look at the presentations after. Thank you ever so much. Have a good rest of the day, and I hope you get a bit of sunshine, because the sun's shining through my window, which is beautiful. So thank you all. Oh, is it not? Oh.
I'm in Pontefract.
Oh, it'll be coming over to you later. It's coming to Barnsley first and then over to Pontefract. Thank you ever so much. Have a great rest of the day, and thank you for your involvement.
Thank you. Bye, everybody.
Bye, everyone. Bye.